HIV, tuberculosis, and malaria in Malawi. In Malawi, 9.2 to 10.8%, or approximately 1 million people, are currently infected with HIV. This estimate will vary according to the source. More women than men are infected with HIV, and they tend to become infected at earlier ages. Different regions of Malawi have different rates of infection, varying between 4.9% and 17.7%. And here's a reference for more information. Malawi has made tremendous progress in reducing the rate of infection over the last 3 decades. Education, which leads to changes in behavior, and ART, a medicine, are thought to have made large contributions to the decrease in HIV incidence. Now, incidence on this chart, those are the new infections, and that's the blue line. So it's going up as late as 1994. It's been going down fairly dramatically. And here's the prevalence, the percent in the population. So it was peaking here, and that's going down also. The rate of HIV infection is going down because the Malawi National HIV Prevention Strategy includes education on HIV prevention, with recommendations for abstinence, being faithful, and using condoms, also known as ABC. Okay, here's A, here's the B, here's the C, as part of a life skills education program, LSE. One study has indicated that Malawians are using condoms more frequently and having fewer partners. More information here at this site. Since 1994, the Malawi government has provided access to antiretroviral therapy, or ART. In 2020, more than 75% of people living with HIV were on ART. Providing this to all pregnant and nursing mothers has had a huge impact on controlling new infections. And again, another site with some more information. HIV testing and counseling services have increased and more people are using them. The 2020 UNAIDS 9090 targets were 90% of people are tested and know their HIV status, 90% of HIV-infected people are on ART, and 90% of those on ART are being virally suppressed. Malawi is making significant progress through these goals. Over 70% of people living with HIV are receiving ART and are virally suppressed. In the future, self-testing kits will help more people be aware of their HIV status. Pre-exposure prophylaxis, PrEP, though not yet available in Malawi, can prevent initial HIV infections when taken every day. PrEP protects people who are at high risk of HIV infection by inhibiting reverse transcriptase, the enzyme that HIV needs in order to replicate. Myths and misconceptions undermine some of the great progress described and contribute to the higher rate of infection in Malawi, 10%, than many other countries. Some communities in Malawi have less knowledge about HIV facts. In 2010, approximately 40 to 60% of young people under the age of 24 did not have access to accurate information about the prevention of HIV infections. While education is improving, the survey showed that 45% of women and 37% of men in some parts of Malawi were found to believe at least one false idea about HIV. The survey included questions about whether witchcraft, sharing food, or mosquito bites can transmit HIV, and whether a healthy-looking person can be infected with HIV. Cultural factors make a difference. The level of understanding varied between regions of Malawi, religious beliefs, ethnic groups, gender, and income levels. One common source of confusion is the impact of male circumcision on HIV transmission. Male circumcision is a good idea for men because circumcised men do not contract HIV as frequently as uncircumcised men. One study showed that voluntary male circumcision, VMCC, decreased the rate of HIV transmission from women to men by 60%. However, circumcised men can still be infected with HIV. The study also showed that circumcised men who have HIV infect their partners just as frequently as uncircumcised men infect their partners. The partners of circumcised men are no safer than the partners of uncircumcised men. Many of those surveys believe the false idea that circumcised men are less likely to infect others than uncircumcised men. VMCC benefits the entire community because fewer men in the community will be infected, and so there will be a decreased spread of HIV. Circumcised men should still use condoms to avoid becoming infected or spreading HIV in their communities. VMCC is a healthy choice, but it does not keep communities safe by itself. And here's the information on that. Some more facts. HIV requires transmission directly from a body fluid to the blood. It is usually transmitted through sexual intercourse. Healthy-looking people can be infected with HIV and can infect others. There is no risk involved with getting tested for HIV. ART can suppress the virus and transmission by infected people. ABC behaviors can keep people safe from HIV infection. Abstinence, being faithful, and using condoms. A, B, C. Education about HIV helps people stay safer. Some challenges. Increased testing among men and young people is needed. International funding for HIV prevention is uncertain. People in some areas of Malawi lack access to health care, testing, counseling, and ART. There is a lack of healthcare workers and lab facilities for HIV patient support. And some groups of people have less access to formal education. In 2002, a study by CARE International found these costs to Malawi that resulted from the uncontrolled spread of HIV infection. Families spend time and energy caring for their infected relatives rather than working. Families divert money to medical expenses for their infected relatives. Children of adults with AIDS miss school to help with farming and other tasks. Skilled laborers are lost from the workforce. Women living in some communities may be unable to support their families if their husbands die from untreated HIV. And finally, healthcare facilities are struggling due to increased hospitalizations and a decrease in healthcare workers. Tuberculosis. Tuberculosis is a disease caused by the rod-shaped bacterium Mycobacterium tuberculosis. While tuberculosis can cause damage to the lungs, the infection may also spread to other tissues and cause more severe illness. In Malawi, 47% of people living with HIV also have TB. Tuberculosis is a leading cause of death in Malawi. Malaria is the most widespread infectious disease in the world. It is caused by 4 different species of Plasmodium, protozoan parasites. Plasmodium falciparum is the species that causes 95% of malaria in Malawi. In 2019, there are over 5 million cases of malaria reported in Malawi, making it one of the 20 countries in the world that is most affected by the disease. Malaria infections are most serious in children under 5 and are a leading cause of death for children. The new anti-plasmodium vaccine program in Malawi should greatly reduce illness and death of children in Malawi. And here's a reference on malaria.